Kidney Health Programme for CLAHRC Greater Manchester includes several aligned projects, all focused on improving kidney health for patients across Greater Manchester and also further afield.
The key aspect of it is, or the vision, is really to begin to make kidney health meaningful for the public, for patients and for health practitioners, particularly in primary care. We're very much aligned with national initiatives and to sort of begin to set some priorities, and also doing some work within local organisations, both in primary and secondary care.
For the last several years, a lot of our work for CLAHRC Greater Manchester has focused on chronic kidney disease, and I think the legacy of some of that work has improved coding of patients and improved management to best guidance, and also much of the work has involved education for professionals, so there's much greater confidence about treating patients with chronic kidney disease.
A key aspect is actually beginning to develop enduring partnerships and setting frameworks, and that involves a lot of going out and meeting people in different settings and beginning to work together to define and identify key priorities and build something up from an understanding of everyday practice. I would say that is an essential focus of what CLAHRC Greater Manchester aims to do and hopefully will offer over time.
CLAHRC's kidney work is important because when you look at all the evidence that's out there, chronic kidney disease is actually a key part of healthcare and actually plays a part in lots of other diseases that we are already managing. CKD can be an earlier identifier, and perhaps if we can begin to manage those earlier and more appropriately, we improve care generally.
We're looking at projects focused on prevention, trying to stop AKI developing in the first place, looking and supporting and evaluating projects in hospital settings, and then also looking at what happens to patients when they come out of hospital to make sure that they're managed to best practice.
I think it also means that we can have a more meaningful discussion with the patient, again about promoting self-care and issues that they need to bring back to us. General practice, sometimes it's very much we get told to do things without any reason or particular evidence, whereas CLAHRC have actually been very good at giving us information.
The real added benefit for CLAHRC being involved in these pieces of work is access to expertise. CLAHRC as an organisation is there to get research into practice. So we link in with researchers and experts to support work going on in clinical practice.